Start with my intro. So thank you guys so much for joining us today for our first community health education session in February for heart health. And our topic today is going to be a heart health diagnosis and how your heart reacts after a COVID diagnosis. My name is Danielle Harmon, and I am your moderator today, and I'm our Community Development Director for ARH. We know that some of the symptoms of COVID can last for months after your diagnosis. And we also know that some of those symptoms and the COVID diagnosis itself can affect some of our organs for long term, including our lungs, our brain, and our hearts. And so we have Dr. Adnan Bhopalwala here today, and he's going to talk to you a little bit about what you can expect and what you should look for after that COVID diagnosis as pertains to your heart. And we're very, very happy to have Dr. Adnan to speak with us today. Since the beginning of COVID-19, we've had about 28 million people diagnosed with the virus and about 500,000 people pass away. So it's very important for us to learn as much as we can. Of course, not getting COVID is the best avenue to stay healthy and to not have these effects. But should we have COVID, it's important to learn about what we should expect and then, how to deal with those health outcomes later. So a few housekeeping items just before we get started. The Q&A sessions should be open throughout the duration of this webinar. Please feel free to ask your questions. If you sent a question in beforehand via email, I do have those, and Dr. Adnan has had those, and so they will be incorporated into his presentation. If there are some that are not in his presentation, I will ask those for you at the end of the webinar. And again, if you have any that you would like to ask during the webinar, please type those in the Q&A and we will get to them at the end. Dr. Adnan, of course, cannot provide specific medical advice on this webinar. So if you have questions or need referrals about your own health and very specific questions that we cannot answer, please contact your medical provider. And if you do not have one, then you can find one at arh.org who should be able to help you. Dr. Adnan Bhopalwala is a board certified in internal medicine and cardiovascular disease, and he works in our cardiovascular team in Whitesburg, ARH. Dr. Adnan is a completion of his residency at Michigan State University, and he also completed his fellowship in cardiovascular disease at University of Hawaii. And Dr. Adnan, I would love to talk to you sometime about the population health differences in Appalachia and Hawaii, but that's for another day. So for now, I will hand the reins over to Dr. Adnan, who can talk a little bit about your heart health after a COVID diagnosis. And Dr. Adnan, I will pop back up at the end for Q&A. Until then, I will be muted and you will see me then. Thank you so much.
Danielle, thank you for that introduction, and thanks everyone for joining. Good afternoon. And we're hoping to shed some light on this very prevalent disease, this pandemic affecting globally, affecting a lot of us around the world. So today we're going to talk about cardiac manifestations of COVID, and most importantly, what to look out for, what to watch out for, what symptoms after you've had COVID, and how to go about post-COVID and your heart. It's extremely important to understand, and like Danielle mentioned, prevention is the best cure in this situation. But as much as we try to do that, we'll try to also highlight today importances of cardiac health and pre and post-COVID. So I want to briefly recap what is COVID, how can it affect your heart, and then get into details about post-COVID diagnosis. COVID-19, as we know, is an illness that infects the lungs. It's caused by the new coronavirus that started in China in late 2019 and has quickly spread worldwide. Although it's part of the same family of viruses that causes the common cold, we all know COVID-19 is very different. One important difference, it was never seen in humans before, and so nobody had existing immunity to it. That is, your ability to naturally fight it. We're learning about this virus every day. Things we don't know yet, what are the long-term health, and in our topic, cardiovascular health and effects that might be. Whether it will stick around or come back in the months and years ahead. What about these new strains that have come up? What about getting infection again after you've had infection already, or even after having the vaccination? Why do some people get very ill, while others don't? And this new terminology of long haulers, patients who've had COVID-19 infection and continue to have symptoms for a prolonged duration of time. Signs and symptoms, I'm not going to dive into the details. We've all experienced or seen these symptoms very commonly now. It's a flu-like syndrome, right from shortness of breath, coughing, respiratory symptoms, generalized weakness, malaise, exercise intolerance, loss of taste, smell, GI illnesses like nausea, vomiting, diarrhea, just to name a few. You could have mild or moderate symptoms. Some people get extremely sick, need to be admitted. Patients who are admitted to the hospital with low oxygen levels, with a COVID pneumonia and other illness, sometimes need to be on a ventilator for an amount of duration. But many people don't have any symptoms and are asymptomatic carriers of the infection. Cannot emphasize this more. Treatment is the best cure. Masking, social distancing, and now the vaccination. In hospitalized patients, the main focus of treatment is to control the infection, manage symptoms and complications, using medications to lower fevers, oxygen, support supplemental oxygen. For extremely sick patients with so-called ARDS and respiratory involvement need to be on ventilators and other supportive measures. Medications like steroids and dexamethasone is used quite efficiently and effectively. Drugs like remdesivir and neutralizing antibody infusions can be used. In select patients, drugs to prevent blood clots is recommended. Now, steroids and some antifibrotic agents are under study in patients with lung fibrosis post-COVID. This is an important topic, and we'll try to talk a little bit about it later during the presentation about post-COVID lung involvement and heart involvement. Protect yourself and others, prevention, like I said, wash your hands, soap and water at least 20 seconds, use at least 60% alcohol-based sanitizers, cover your sneezes and coughs, avoid touching your eyes, nose, and mouth, clean surfaces often touched, get vaccinated against the flu, pneumococcal disease, and COVID. All of this is extremely important. Let me emphasize this again about the flu shots. Patients who have heart problems or cardiovascular disease are more vulnerable not only to COVID-19, but also to the seasonal flu. This is still relevant. If you've not had your flu shot, I would encourage you to still do it. If you have any heart disease, you're more likely to have serious complications from the flu. Now, these includes pneumonia, heart attack, hospitalization, stroke, and death. The flu vaccine can help you lower the risk of a heart attack, lower risk of stroke, and heart failure. Avoid dangerous complications and stay healthy. COVID-19 vaccinations have been rolling out now in the class 1C rollout. If you have a heart condition, you're more likely to get very sick from COVID. Vaccines given as shots are now available to more people and will become a powerful way to prevent you from getting COVID. And also post-COVID, people can generally get it 2 to 3 months, 90 days if you have been treated with a convalescent plasma or antibody infusion when you had COVID-19 infection. Again, I'd like to reemphasize about this pandemic. And initially when it started, we saw a great increase in patients, decline in patients coming to the ER with hypertensive urgency, stroke, and heart attacks. So heart attacks and strokes are going to continue to happen during this pandemic, even going forward. Please do not delay. Call 911 if you're having any symptoms of heart attack and stroke. You're much more likely to have a bad outcome if you ignore symptoms related to your heart condition. This is a slide from last year. Earlier, soon after the pandemic began, there was a 23% decrease in heart attack related ER admissions, 20% in stroke, and uncontrolled blood pressure. So this again remains an extremely important message is to not ignore an acute condition. If you're having uncontrolled blood pressure, symptoms of heart attack and stroke, you're better off going to the ER and getting that treated. What are symptoms of heart attack? Chest pain, difficulty breathing, discomfort in the chest, arms, jaw, neck, or shoulder. Symptoms of stroke, numbness or weakness or loss of movement in your face, your arm, confusion, trouble speaking or comprehension, loss of balance. If you have any of these symptoms, whether you've had COVID or you've not, you're better off calling 911, taking care of these symptoms immediately to have a better outcome. And most hospitals have now had an experience of over a year to deal with these emergencies and can take care of you. So now let's dive into more details about COVID and how it affects your body. COVID-19 has these M spikes, and these spike proteins on the virus attached to a receptor in the cells of your body called the ACE2 receptors. Now, these receptors are not only present on the lungs, where the virus is predominantly attacking and having presenting with pneumonia and lung problems. But these receptors and this virus is now shown that it affects multiple systems of the body, including right from basically the top to bottom. So you have loss of taste and smell, so it affects your nerves and neurological symptoms. It affects your lungs. It affects your heart in the cardiac muscle itself, the blood arteries of the body, the blood vessels, the clotting system, like the kidneys. Like I said, brain, and there's this phenomenon of post-COVID brain fog, which is now being identified where patients have difficulty in remembering things, in concentration, and stuff like that. So COVID-19 is a multi-system disease. Talking about the heart, majority of people with COVID-19 recover completely without major symptoms from a cardiac standpoint. Patients who have pre-existing and vascular disease, heart and vascular disease, have an increased risk of developing complications from COVID-19. Given the extent of widespread COVID-19 infections, common involvement of the cardiovascular system, it is important that cardiologists and the cardiac community in general characterize these long-term issues that survivors of the virus may face. We do have some research and studies which have come up, but this is, let me tell you, an ongoing process and much to learn. What increases your risk of serious COVID-19 infection in the heart? So extremely important, like we have seen already around the nation and the world, is adults more than 65 years of age. People living in close quarters, nursing homes, long-term facilities are at more risk. People with existing heart conditions, congestive heart failure, coronary artery disease, abnormal heart rhythms like atrial fibrillation, uncontrolled blood pressure or hypertension. Lung disease, COPD, black lung in our population, moderate to severe asthma, diabetes, especially uncontrolled diabetes or poorly controlled diabetes, where you're needing insulin and your glucose still high. Illness that lowers the immune system's ability to fight infection, people who are cancer survivors on cancer medications, other immune medications, which lowers your immunity. Obesity, extremely important, obesity and smoking. Now, please remember 1.4 times more likely if you're a heavy smoker to have more symptoms from COVID-19, you're 2.4 times more likely to need ICU admissions and mechanical ventilation or die compared to non-smokers. A growing number of studies have suggested COVID-19 survivors now experience some type of heart damage. This can be clinical or subclinical. That means you don't have symptoms from it, especially patients. This is more important in patients who have been sicker in the hospital, especially have had prolonged hospitalization. Now, how can the virus affect the heart and what are the manifestations? We'll try to cover some of these in detail. One most important and talked about manifestation of COVID infection in the heart is inflammation or infection of the heart muscle itself called myocarditis. Now, this is a topic of research and we're yet to learn a lot about it, but I'll tell you what we know about this so far. Second is heart failure. You may already have a diagnosis of congestive heart failure. This can get exacerbated. A systemic COVID illness can cause new heart failure symptoms. Reversible heart failure or broken heart syndrome, which is also called Takotsubo cardiomyopathy. Abnormal heart rhythms, which can be dangerous heart rhythms like ventricular tachycardia, atrial fibrillation, and others. Hypertension and the relation to COVID-19. Inflammation of the lining of blood vessels and blood clots to form. And obviously, most important, last but not the least, is heart attacks. Let's talk about myocarditis. This is inflammation of the heart muscle, either directly from viral invasion of the heart muscle, or more commonly, this is seen not from the virus in the muscle of the heart, but from the body's immune system, a systemic inflammatory response syndrome, which affects multiple organs and affects the heart to cause inflammation in the heart muscle, or fibrosis and long-term scar in your heart, lungs, and that's commonly seen with COVID, post-COVID. A JAMA, which is a journal in internal medicine study, has used cardiac MRIs on 100 people who recovered from COVID-19. This is one of many studies which are now being more and more published, and people are still looking at a lot of studies about MRI findings, but this is one of them which found abnormalities in hearts of about up to 80% patients with ongoing inflammation post-COVID. The same study had found high levels of blood enzyme called troponin, which is leaked from the heart muscle, an indicator of heart damage in 76% of these patients. Now, most of these patients in the study had not required hospitalization. So this one study has shed light on involvement of the heart muscle in patients not necessarily extremely sick to require hospitalization. Now, this is a younger patient who had elevated cardiac troponin, or this enzyme we worry about for heart attacks in general, but it can also be from myocarditis or inflammation of the heart muscle seen in COVID. This patient got a cardiac CT scan. It showed that the arteries of his heart was normal, and subsequently he got a workup with a cardiac MRI, and it shows inflammation in this picture here in the heart muscle, and this may lead to scarring or fibrosis in the future. Now, congestive heart failure can either be, you could have congestive heart failure as a diagnosis prior to admission. If you have severe systemic illness or COVID infection, that puts extra stress on your heart and may lead to exacerbation of heart failure. Symptoms of heart failure includes shortness of breath, chest tightness, gaining weight or fluid retention in your lungs, which leads to shortness of breath. It could be in your legs, leads to peripheral edema. Hospitalized patients with moderate to severe COVID infection and heart failure do worse. This is pretty much a well-known fact by now. The patients with severe heart failure and severe COVID infection have done worse, as much as 25% or more die. Diagnosis of heart failure depends on a physical examination. There's blood tests called BNP or pro-BNP levels, cardiac troponin or markers of injury to the heart muscle, D-dimer levels, and other lab evaluation. Cardiac imaging is helpful. We start off with an ultrasound of the heart called echocardiogram, and cardiac MRI and cardiac CT scan, like we looked at those pictures, are helpful in select patients. Patients at home and post-discharge need close monitoring of their symptoms, daily weight, accurate medication reconciliation, periodic blood tests, and repeat imaging or ultrasound in some cases, like an echocardiogram, in select patients. Now, this is another slide which highlights in multiple ways how COVID-19 infection can affect your heart. And we can look at that on ultrasound or echocardiography. So sepsis what sepsis means is a generalized infection in your body. With COVID-19, it's more of a systemic inflammatory response syndrome. Patients who are ventilated can have right ventricular failure. Patients can get blood clots and pulmonary embolism. That in turn puts an increased stress on especially the right side of your heart and causes what we call as what we call RV failure or right ventricular failure. Acute myocarditis, we talked about this a little bit, where the virus infects, or if you take a biopsy of the heart, we'll find virus or particles of the virus in the heart muscle itself, or acute myocarditis. This is not more common, but devastating to have. And heart failure, like we talked about. Now, treatment is salt and water restriction, getting rid of the fluid with medications like water pills or diuretics like Lasix and other pills, a guideline-directed medical therapy with medications to keep the heart muscle strong and make it stronger, blood thinners in certain patients. Now let's talk about reversible heart syndrome. I have personally seen many patients will have stress on the heart from this systemic illness. These are sicker patients usually who are in the hospital and have stayed in the hospital for a long enough time with systemic and lung involvement and systemic severe illness with COVID. Because of the stress, the acute stress on the heart muscle gets weak. It's called broken heart syndrome. It's called Takotsubo cardiomyopathy. The good news about this particular condition is with medications and with treatment, most of the patients get a better resolves with time, and the heart muscle and heart function improves. Some of these patients, if especially during the hospitalization, have abnormal heart rhythms called ventricular tachycardia, or extra beats coming from the bottom portion of your heart called PVCs, or premature ventricular contractions. We tend to put on a device called a life vest, which you wear as an external jacket, which protects the heart until the heart function improves in close monitoring. In 2 to 3 weeks, usually we'll end up repeating an ultrasound of the heart. Now, what's the association of hypertension and COVID-19? Now, right from initial reports from Wuhan, New York, Italian experience, it was found to have high rates of hypertension among hospitalized COVID-19 patients. In more recent report, 56% of hospitalized COVID-19 patients in a large New York health system presented with a diagnosis of uncontrolled hypertension. In case series, patients with hypertension and COVID-19 infection have higher rates of morbidity. That means they have sicker disease, they get more sick, and mortality, which is death rate. These are usually blood pressure, hypertension patients who have the blood pressure not adequately controlled. So the takeaway point is that you are at risk if you have hypertension and cardiac problems to have COVID-19, but your risk is lower if you take good control, or if your disease and your blood pressure is well controlled. So the goal blood pressure for more or less for the most people is less than 130 on the top, less than 80 on the bottom. Patients must continue all prescribed blood pressure medications, including medications like losartan, ACE inhibitors, ARBs. Initially, there was a lot of confusion, but do not stop your blood pressure medicines without consulting with your primary doctor or your cardiologist. I would like to emphasize the need for telehealth. Now, even if you're discharged from the hospital after your COVID infection, or you're in home quarantine with your COVID infection, if you notice your blood pressure is high and uncontrolled, take advantage of virtual health or telehealth. This can be a Zoom call, this can be some kind of a video conferencing, or it can just be a telephone call with your cardiologist or with your primary doctor who can help you out to adjust your medications and other things to lower your BP in that interim until you can go visit with them in the office. Another extremely important manifestation of COVID on the cardiovascular system is how it affects or increases the chances of blood clot formation in your entire body. Okay, the most devastating of this is if you have blood clots in the veins of your legs, called deep vein thrombosis, like this diagram shows here. These blood clots can cause problems in your legs, but more so if they travel to your lungs, it can cause a condition called acute pulmonary embolism, or PE, wherein this blood clot, this white diagram is your pulmonary artery, or artery of your lungs, and this black diagram, the black shadow, is the large blood clot. This can be devastating, even lethal, if not appropriately treated in the right time with blood thinners. So patients in the hospital with severe illness, there's recommendations now about treating prophylactically with blood thinners depending on your individual status. Some select patients need blood thinners, and there's been some questions about this in our audience, to be continued after discharge for short term. Now, these are expert opinions. We have to take a lot of things and individualized decision making, and not recommended for everybody. These are for high risk patients, especially patients who've had a prolonged hospitalization, been on the ventilator for 10 days, you've been in the hospital for 2 or 3 weeks, then you're better off going home with a month's supply of an oral blood thinner. Or if you've had a recent history of blood clot. So for the most patients who are mobile, who can walk, who are not as sick, who are not on oxygen, we usually do not feel yet that we need blood thinners, but only for sicker patients. It's important that when you are discharged or at home with quarantine, to take measures to prevent blood clots. These blood clots, COVID makes you have an increased chance of having blood clots. So does prolonged immobilization, prolonged travel, and these things what we know of from before COVID. So it's important that you exercise your legs, you keep moving in the house, even if you're in quarantine or isolation. Maintain exercises on your legs, on your feet, on your calves, by doing sort of an extension pronation exercise, and get your blood flow keep going. But if you develop new symptoms of breathlessness, which is sudden onset, your heart's racing, or tachycardia sudden onset in the recent past, if you've had a D-dimer blood test and it's been elevated, then all of these are red flags, and you must seek medical attention. The sooner the better. Now, let's talk about abnormal heart rhythms or arrhythmias of the heart. It's not uncommon for patients to have palpitations and tachycardia with exercise post moderate to severe COVID illness. Now, this can be for multiple things. The fact that you've been sick in the hospital and have been recovering from a pneumonia, or even at home, you're going to have initial exercise intolerance, and that may be perceived as heart palpitations. But if you have persistent symptoms, you have palpitations without any activity, at rest, then you're better off seeking consultation and evaluation. Some patients in the hospital, like we talked about, have dangerous heart rhythms called ventricular tachycardia, and these patients need to be closely monitored and treated. Atrial fibrillation is extremely common and can be exacerbated by the systemic illness COVID-19 causes. Now, if you're at home and if you're still in quarantine and isolation, take advantage of remote monitoring. If you already have a pacemaker, an ICD, a defibrillator device, these can be interrogated remotely. You need to call your electrophysiologist, your heart doctor, and they can, at many times, send you devices to remotely interrogate your device and know what's going on with your heart. We can also send you what it shows in the picture here. It's an event monitor or a Holter monitor. We can send this home, and you can, with easy setup instructions, you can put it on yourself and then mail it back in, and we can download and get information on your heart from anywhere from 2 to 15 days or longer in some instances. Now, why this cardiac arrhythmia has become such a topic of importance is especially because of athletes returning back to play. We are learning about this. We still don't have enough data or research to be able to lay down guidelines. But what we've seen is some subclinical infections in theory, like we said, leads to myocardial inflammation. And in the future, this can lead to fibrosis and scarring in the muscle of the heart. Now, this area in the heart, which is scarred, can lead to abnormal heart rhythm called ventricular tachycardia, which can be devastating and dangerous, especially in the younger folks. These patients, needless to say, must consult with their cardiologist, and it's a stepwise approach. Younger patients, especially for athletes to return to play and competitive sports, it becomes an important topic of discussion because we have seen that once you have COVID illness, any kind of competitive or exertion right after the illness can actually make the virus more dangerous in the heart. And if you have had scarring in the heart already, it can make you more prone to have these abnormal heart rhythms called ventricular tachycardia. So in this situation, a stepwise approach becomes extremely important. Younger patients and athletes returning to vigorous exercise post-COVID should be extremely vigilant. What you watch out for is palpitations at rest, shortness of breath, dizziness, passing out spells or fainting spells is ominous and must lead to immediate consultation. Return to aggressive training in a stepwise approach. Seek medical attention when necessary. Now, we all know about PPE, right? So PPE in this situation is actually two things you got to remember. One is prevention, personal protective equipment, wear your mask. And second, for athletes or patients, it's prior to practice evaluation. So remember PPE in two contexts in this situation. Now, this slide, I'm not going to dive into the details, but this is a recent sort of not recommendation, but an expert opinion in a way by Kentucky Medical Association with Kentucky High School Athletic Association. And these are the recommendations they're laying out there for you to look at, you to be aware and educated about. And then eventually it's the shared decision making of a young athlete to go back to competitive sports and aggressive exercise and training immediately after your COVID illness, depending on your symptoms, and it's a shared decision making with the athlete, with the parent, and with a multi-specialty primary doctor and cardiologist in many instances. Just briefly, it depends on what your symptoms have been. You're completely asymptomatic, you've done 14 days of quarantine. In those cases, mostly you can go back to training and be watchful of the symptoms. And the training has to be in a stepwise approach, go back in a stepwise approach. But for patients who have mild to moderate illness or have had severe illness, then the recommendations is you're better off seeing or getting cleared by your primary doctor, by your MD, a cardiologist in some instances. You're better off having an evaluation and examination, getting an EKG in some instances, ultrasound or echocardiogram of your heart, and a blood test called high sensitivity troponin. Especially if you've been sick in the hospital or have had any symptoms which are persistent or any red flags, like we talked about, in those situations, cardiology consultation should be taken, cardiac MRI of the heart. And how do we interpret these images needs a very careful consideration and sometimes multidisciplinary approach consultation, also with your general cardiologist and electrophysiologist. Now, this is a nice slide about how it's been laid out in a stepwise approach to return back to training. Immediately after COVID-19, your heart is most vulnerable. So you have to build it up, build your training up to maximum levels like pre-COVID exercise levels. Heart rates of 80% or higher should be in a stepwise approach. Okay, heart attacks, like we've already talked about a little bit, is your most important part about heart attack and COVID is prevention. COVID can increase your chances of heart attack, and it can affect the arteries of your heart and cause heart damage in multiple different ways. It's not always the conventional blockage of an artery, but if it is, you're better off identifying those symptoms and taking care. The blocked artery is taken care of in the COVID pandemic now, just as it would have been at any other time with blood thinners, and for select patients, need to go to the cath lab and have an artery opened up with a balloon and a stent procedure. So most important consideration here is to identify your symptoms and seek care. Okay, so let's try to recap in the next few slides about what we already talked about. Who should seek help, right? It can be it can be difficult to identify who is at risk of recovering from the virus. A lot of people will feel or end up feeling exhausted for a while, especially if you've had any pneumonia or any moderate to severe symptoms of COVID. You cannot get back up to the exertion level that you were at before, at least not immediately. We're seeing these patients who are having these long haulers. You're having symptoms for a longer time. So we got to tease it out, whether it's your heart or it is your lung, or you're just taking longer time to feel better and back to normal activities levels from your lungs. So it's a multidisciplinary approach. It's not it can be multiple systems, and we have to look at each one of them in different in closer evaluation. Despite of this, what are the symptoms? What are the red flags, so to say? This is if your symptoms continue to get worse and not better. You continue to have severe chest pain. You get swelling of your ankles. This is heart failure manifestation. Heart palpitations at rest, irregular heart rhythms, not being able to lie flat without shortness of breath. That means your lungs are filling up with fluid. Waking up at night, gasping for air, or anytime you lie flat, you gasp for air. That could be a sign of heart failure. Dizziness, lightheadedness, passing out, or fainting are important signs to symptoms to identify. Now, a small slide on COVID considerations for the elderly. Extremely vulnerable population and extremely important population to follow from a cardiovascular standpoint post-COVID. In this slide, I would like to only encourage, I'd like to encourage this one point very importantly, and that is having close follow-up. If you're by yourself, identify your family members who can help you. Take care of telehealth. Telehealth not necessarily needs to be a video. Some people are not confident and comfortable with a video conferencing. You can just pick up the phone and set up a phone call visit with your cardiologist, with your primary doctor. And most importantly, if you've had COVID, make sure you're on the right meds, make sure you're getting your blood tests, make sure your blood pressure is normal, and make sure to use telehealth and call your doctors. So when do you need a consult with a cardiologist? Whether or not you have been hospitalized with COVID-19, experienced cardiac symptoms from the virus, or have had pre-existing conditions, you may consult in person or telehealth options. Laboratory testing in the immediate period when in quarantine. Remember, you can take care of curbside labs, certain labs like high sensitivity cardiac troponin and high sensitivity CRP. These are important to understand what's going on with your heart and your lungs in case of CRP. Further testing from the heart that can be done is a simple EKG, an ultrasound of the heart called an echocardiogram to look at your heart muscle, make sure it's not damaged. And in select patients, we have higher sort of imaging with cardiac MRI and CT scans dedicated for the heart. While you're teasing your symptoms out with your cardiologist, remember the more common abnormality with severe COVID-19 infections is also pulmonary fibrosis. Now, so for this, you need to be evaluated, sometimes doing a 6-minute walk test, getting a pulse oximeter, checking your oxygen levels at home after the diagnosis, doing pulmonary function tests, and in select patients, doing a CT scan of your chest can diagnose and lead to appropriate treatment with your pulmonologist about this pulmonary fibrosis, especially in patients who are having symptoms for a longer time. Remember, COVID, we are learning more and more now. Some people, like I said, most commonly is the lungs and the heart, blood clots. but now kidneys are being involved, and we're learning more about that. We're learning more about certain patients having brain sort of fog, having difficulty concentration. So the way I see it, COVID-19, post-COVID-19 is going to be a multidisciplinary approach, and specialty clinics where we look at these different aspects as we learn more about it in the times to come. Some tips to wrap up, to stay heart strong even after you've had COVID-19 infection, is to stay healthy, to eat healthy, to booster your immune system. Choose heart-healthy foods and snacks, plant unprocessed foods, plant-based, more fruits, more vegetables. Exercise daily, depending on your symptomatology, and this has to be individualized. Stay hydrated, drink plenty of water, get enough rest and sleep. Don't smoke, don't overindulge in alcohol. Follow your care plan, stay up to date with vaccines, extremely important. In the class 1C rollout, there's a new paper now and recommendations about how cardiac patients or patients with heart disease, especially with higher illness and acuity, should be preferred in the next vaccination rollout. So I hope to see that be implemented soon. Ensure you have at least 1 month of blood supply. Medication supply. Once you go home after your diagnosis for quarantine or isolation. Maintain social distancing, but don't socially isolate yourself. Stay connected with family and friends on social media, video conferencing platforms. Make sure to take all your medicines unless you check with your doctor. ACE inhibitors, ARBs, statins, these are medicines you may be on for cardiac problems, and you must continue unless there's a specific reason to stop. Very select high-risk patients, like we talked about, need oral blood thinners for 1 month, especially if they've been in the hospital with severe COVID illness, to prevent blood clot formation. If you have any questions, take advantage of telemedicine. So to wrap it up, maintain social distancing, wear a mask, manage stress, call the state or ARH helpline numbers for stress management, stay connected, and be safe. So that concludes my presentation, and I'd be happy to take any questions. Thank you so much.
Thank you so much, Dr. Adnan. We do have a couple questions. One that came through on the chat, and I'm going to try and read that to you now. And it says, are there any indicators that someone would need to take blood thinners after a COVID diagnosis that was just mildly symptomatic, when they had no comorbidities and they were not hospitalized? So are there any indicators for blood thinners, please?
So thank you for that question. This is an ongoing a topic. So far, the recommendations are reserved for high-risk patients, prolonged hospitalization, if you've had any signs or symptoms of blood clots in the past, if you've had blood clots in the past. But if you're able to move around, you're not extremely sick, if you don't show any signs of unexpected breathlessness, unexpected heart racing, then I would say no, that you don't need a blood thinner.
Okay, thank you so much. So next question, and this came through on email, I believe this morning, but after I sent you the question, so I apologize. And it says, what complications are we seeing on the heart post-COVID versus those that we see from other critical illnesses like sepsis or SARS?
So, I would say it's the same because the illness, most of your cardiac manifestations is from a severe illness or respiratory distress syndrome. The topic about COVID myocarditis or inflammation of the muscle of the heart is of ongoing research. And in some ways, the way the immune system of the body has shown to react in COVID-19, and there's a lot of literature already about this, is a bit unique in the way COVID sets the immune response. It has to be. I mean, COVID's not gone away. All the other viruses, COVID's doing worse with compared to everything else. So there probably is more of a unique immune response because of COVID, and that may or may not lead to a higher prevalence of this myocarditis or inflammation of the heart muscle, but we're still to see. That we need more and more studies and people who are looking at MRIs and echoes and publish their data to be able to say if this is more than other illnesses, the way the COVID affects the heart and causes myocarditis, and which may be important for sudden cardiac death and abnormal heart rhythms in the future.
Thank you, thank you. So some key takeaways from today's presentation, and this was probably the most thorough one that we have had, so thank you very much. I think you answered every single question that I had posed to you before that we had come through on email, so thank you. So without COVID, if you have not had COVID, just to control your blood pressure, try to maintain your weight, to live a healthy lifestyle, and that will help you if you do get COVID. And then for our patients that have had COVID, I think that what you mentioned was to pay attention to your symptoms after discharge, to make sure that to watch, your weight and make sure that you're monitoring everything that you need to from home to know when you need to go back to the hospital should you need to. So are there any other key takeaways that if you, at the end of your presentation, you hope someone remembered just a couple things, what would those be?
Prevention. I would like to emphasize that we don't know yet, even if you've had COVID-19, if you're vulnerable to get a reinfection. I would say you got to, prevention is your best cure. Staying heart healthy, and all of the slides I've shown about COVID and the heart, remember, it's most of the conditions lead to a bad outcome if they're uncontrolled. So the only, again, as a preventive cardiologist, I'd like to say is take care of your blood pressure, take care of your heart failure, take your medicines, make sure you have enough medicines, make sure your med reconciliation is appropriate, make sure you follow up on a regular basis with your doctors to be able to prevent sometimes may not prevent the illness, but may prevent the severity of the illness. And post-COVID now, I would say get vaccinated. It's extremely important that you get vaccinated, and as soon as it's available for you, and it will be soon. Now it's coming for the general public.
Thank you. And one last thing, since your bio was not very long that I presented in the beginning, can you give a short plug about yourself, where you went to school and where people can find you should they need a cardiologist?
So, so currently I'm at Whitesburg, like you know, Whitesburg is pretty much full-time here in Whitesburg with Cardiology Associates. I grew up, so I grew up in Bombay. I've been a nomad, I think. I've just been everywhere. I grew up in Bombay or Mumbai in India. Then been at Michigan State in Grand Rapids, Michigan for my residency training. I went to Hawaii, which was very random. Had the best time in Honolulu for my cardiology training. And in the past 5 years, me, my wife, Sarah, and our kids, we've been here in Whitesburg.
I think we all envy your time in Hawaii, so very jealous. But we're very, very grateful to have you in Appalachia, and we're grateful to have you on our team with ARH. So thank you again for being here today. Thanks to all of our participants participated today, and this presentation will also be on our Facebook page shortly, so please watch for it there. If there's anything that you need, you can contact me if you have any questions about this presentation, and I can get with Dr. Adnan and we can answer this for you. My email is dharman@arh.org, and again, thank you so much for participating, and thank you, Dr. Adnan, and that concludes our presentation for today. So thank you guys, please be safe.
Thanks a lot, my pleasure.